Today we are going to talk about loop diuretics. Loop diuretics, drugs in that category are the furosemide or Lasix, bumetanide and torsemide. Drugs in that category are the furosemide, bumetanide, torsemide. Okay, these are the loop diuretics, or it is also called as the high ceiling diuretics or loop diuretics. Why it is called as loop diuretics? Because the site of action is the thick ascending limb of loop of Henle. It acts on the loop of Henle. Which limb? Thick ascending limb. Thick ascending limb of loop of Henle, hence the name is the loop diuretic. Now this loop diuretic binds to the luminal side. There are two sides, luminal side, basolateral membrane. So it will going to act on the luminal side of the sodium-potassium-chloride cotransporter and block the function of this cotransporter. It will going to block the function of this cotransporter, sodium-potassium-chloride cotransporter. So because of the blocking of this cotransporter, there is increased excretion of sodium and chloride in the urine. So tubular fluid that reaches the distal convoluted tubule contains the large amount of sodium. It will contains the large amount of sodium. The renal tubular fluid which reaches to the distal convoluted tubule, it contains the large amount of sodium, and because of that more sodium exchanges with the potassium, and that will lead to the potassium loss. Why there is a potassium loss? Because this loop diuretic, it will going to block the sodium potassium chloride cotransporter, right? So there is an increased excretion of sodium and chloride in the urine. Increased excretion of sodium and chloride. The tubular fluid that reaches to the DCT, distal convoluted tubule, contains the large amount of sodium, and that's why more sodium is exchanged with the potassium. That's why there is a potassium loss. These loop diuretics, they also have weak carbonic anhydrase activity. So there is a excretion of HCO3 or bicarbonate ion. There is a increase in the excretion of bicarbonate ion. These loop diuretics also increases the excretion of calcium and magnesium. There is increased excretion of calcium and magnesium. Means what they are going to lose, or what going means there is a loss of sodium. That is the first thing, loss of sodium. Then there is a loss of potassium, means there is a loss of sodium, loss of potassium, hyponatremia, hypokalemia. Then it also increase the excretion of calcium. That means there is a hypocalcemia and hypomagnesemia. Okay, and there is a excretion of HCO3, bicarbonate loss is also there. Now here you can see the mechanism of action in a diagrammatic representation. This is the tubular fluid, this is the tubular cell, and this is the interstitium. Tubular lumen, tubular cell, and interstitium. Now as you can see, there is a sodium potassium chloride cotransporter. Sodium potassium chloride cotransporter. So here it will going to inhibit this sodium potassium chloride cotransporter, so that loop diuretic will inhibit that sodium potassium chloride cotransporter. Means cotransporter means all these chloride ion, sodium ion, potassium ion, they will move from tubular fluid to the tubular cell, from the tubular lumen to the tubular cell, and from tubular cell to the interstitium, and that's how they will get reabsorbed. Sodium and chloride is reabsorbed. This is the normal with the help of sodium-potassium-chloride cotransporter, they will reabsorb into the blood or into the interstitium. But what this loop diuretic do? It will going to inhibit the sodium-potassium-chloride cotransporter, and because of that, sodium and chloride excreted from the body. So sodium and chloride excreted from the body. More sodium is exchanged with the potassium because more concentration of sodium reaches to the density. It also increases the excretion of calcium. It also increases the excretion of magnesium, as you can see. Okay. So this is the mechanism of action. Now, loop diuretics are also called as high ceiling diuretics. Why? Because they are highly efficacious. Highly efficacious means maximum sodium excreting capacity. Loop diuretics are having maximal sodium excreting capacity. That's why they will call it as a high ceiling, highly efficacious diuretic. They are rapidly absorbed through GIT. Means you can use orally, you can use intravenously. These loop diuretics or Lasix, they are rapidly absorbed through the GIT. Furosemide and bumetanide, they are administered by oral route, intravenous route and intramuscular route. They can use by this oral, intravenous and intramuscular route. And torsedamide, it's given orally and intramuscularly. Okay. What is the onset of action? Furosemide has a rapid onset of action. When it is given intravenously, the action starts within 2 to 5 minutes. When it is given intramuscularly, action starts after 10 to 20 minutes. And when it is given orally, action starts within 30 to 40 minutes. Now, therapeutic uses of loop diuretics, where we can use this furosemide, Lasix or these loop diuretics. During the initial stages of renal cardiac edema, initial stages of whether it is a renal edema because of kidney, because of cardiac edema, because of heart or congestive cardiac failure, or because of hepatic edema, these things can be used. These things means loop diuretics, furosemide, torsedamide, bumetanide, ethacrynic acid. These things can be used whenever there is a renal edema, cardiac edema or hepatic edema. Or we can say they are very useful in the refractory edema. If not any other drug is useful, you can simply go for the loop diuretics. But vigorous diuresis is avoided in hepatic edema because it may lead to hepatic coma. IV furosemide along with isotonic saline, to prevent the volume depletion, it is used along with the isotonic saline. It is used in the treatment of hypercalcemia. Why it is used in the treatment of hypercalcemia? Because it will promote the excretion of calcium in urine. It promotes the excretion of calcium in the urine. Whenever there is a hypercalcemia, just go for the loop diuretics. It will excrete your calcium, high level of calcium in the urine. Then, why furosemide or Lasix is used in the pulmonary edema? It's a drug of choice in the pulmonary edema or left ventricle failure. Furosemide is used in the pulmonary edema. When intravenously furosemide is given, there is a prostaglandin mediated immediate vasodilatation. When furosemide is given intravenously, prostaglandin mediated immediate vasodilatation, because prostaglandin causes vasodilatation. So that will increases blood in the venous system. So that decreases venous return to the heart. Increases blood in the veins. Decreases venous return to the heart. That's why there is a decrease left ventricular filling pressure, and that will relieve the pulmonary edema. This is the one thing. IV furosemide, it causes diuresis. that will decrease your plasma volume, and ultimately it will going to relieve the pulmonary edema is relieved when intravenously furosemide is given. How come? We'll see one more time. IV furosemide, it causes prostaglandin mediated vasodilatation, so that there is increase in the blood in the veins, so that decrease venous return to the heart, decrease left ventricular filling pressure, and that's how it will relieve the pulmonary edema. IV furosemide causes diuresis directly. It decreases plasma volume, it decreases blood volume, it decreases venous return to the heart, it decreases left ventricular filling pressure, and that's how it relieves the pulmonary edema. Then it is also used in a cerebral edema, but as an alternative, not as a first drug of choice. What is the first drug of choice for the cerebral edema? Mannitol. 20% mannitol is the drug of choice for the cerebral edema because it reduces the intracranial tension by its osmotic action. 20% mannitol is a drug of choice, but if it is not available, you can use loop diuretics in combination with the osmotic diuretics. Then loop diuretics are also used for the forced diuresis. In poisoning cases such as barbiturates, salicylates, furosemide is used along with the IV fluid. Along with the IV fluid, you can go for the forced diuresis to remove these drugs, barbiturates or salicylates, from the body. Then it is also used in the acute hypercalcemia and hyperkalemia. Whenever there is a high level of potassium in your blood or high level of calcium in your blood, high level of potassium and high level of potassium and calcium, so simply you use loop diuretics. It will enhance the excretion of calcium and potassium, and that's why they are useful in acute hypercalcemia or acute hyperkalemia. Now, what are the adverse effects of loop diuretics? It will cause hypokalemia. Because of hypokalemia, there is a fatigue, muscular weakness, cardiac arrhythmias. Because of hypokalemia, there is a fatigue, muscular weakness, there is a cardiac arrhythmia. So, how will you prevent this hypokalemia? Because it is prevented by using combination of loop diuretic along with the potassium sparing diuretic like spironolactone. It is used along with the potassium sparing diuretic which causes hyperkalemia, and loop diuretic causes hypokalemia, so that counteract each other's adverse effect. Or you can simply treat it with the help of KCl, potassium chloride. Then it also causes hyponatremia, depletion of sodium from the body, hyperglycemia, hyperuricemia, and hyperlipidemia. Hyperglycemia because there is a decreased insulin secretion. Hyperglycemia because of decreased insulin secretion. Hyperuricemia because there is a decreased renal excretion of uric acid, and that will precipitate the attack of gout. Hyperlipidemia because they increase the plasma triglyceride and LDL cholesterol level. So these are the metabolic disorders: hyperglycemia, hyperuricemia, and hyperlipidemia. Now other adverse effects like ototoxicity, means there is a chance of deafness because of ethacrynic acid. Drug-induced ototoxicity. It may cause deafness when the drugs like ethacrynic acid is used. Vertigo, tinnitus, it is due to damage to the hair cells of inner ear. If there is a damage to the inner cells of hair cells of inner ear, there is a chance of deafness, vertigo, tinnitus, and ototoxicity is more commonly seen with the ethacrynic acid, and they are reversible on stoppage of therapy. The risk of ototoxicity is increased in patients with renal impairment. If you are having renal failure, there is a risk of ototoxicity is increased. If you are using with drugs like cyclosporine or aminoglycosides, they are highly ototoxic, the risk of ototoxicity increases. There is chance of hypersensitivity reactions in the form of skin rash, eosinophilia, photosensitivity reactions are also occur. Now drug interactions. Drug interactions of loop diuretics. Furosemide or thiazide, they should not be combined with digoxin. Why they should not be combined with the digoxin? Because this diuretics causes hypokalemia, which increases the binding of digoxin to the sodium-potassium ATPase. This hypokalemia increases the binding of digoxin to the sodium-potassium ATPase, leading to the digoxin toxicity. Furosemide should not be used along with the aminoglycoside or cyclosporine because they are highly ototoxic drugs. They will enhance the toxicity when they are used together. They should not be used along with the NSAIDs because NSAIDs inhibit the prostaglandin and prostacyclin synthesis and block prostaglandin mediated hemodynamic changes of the loop diuretics. Chronic use of NSAIDs leads to the sodium and water retention and diminish the antihypertensive effect of loop diuretics or thiazide diuretics. So basically you have to avoid the NSAIDs, avoid the aminoglycoside, cyclosporine and digoxin along with the loop diuretics. That's all for today. Thank you.